Hi, my name is Hailee Richter, and I am a DMP FNP student with UW Oshkosh, and this is my poster on my project, Culturally Sensitive Diabetes Education for Hmong Adults. This was a quality improvement project, and my scholarly project chair was Dr. Catherine Schmidt. So first, just going to talk about some background and give an introduction as to why I pursued this project. So diabetes mellitus is a group of metabolic diseases that is becoming more prevalent in the U.S. This project had to do with type 2 diabetes, and this is especially in minority groups, or it is becoming more prevalent. So that includes the Hmong, which this project involved. And poorly controlled diabetes is associated with several micro and macrovascular complications, and this can cause diabetic retinopathy, diabetic kidney disease, various neuropathies, hypertension, accelerated atherosclerosis, cardiovascular disease, stroke, and peripheral vascular disease. And this is one of the reasons why having adequate control of diabetes is very important as to mitigate some of these complications. And there is an increased prevalence of diabetes in the Hmong, and this may be related to cultural differences such as diet, activity, and spiritual and religious views. To talk a little bit more about these cultural differences, first regarding the diet, so there are some differences relating to what the Hmong eat. So this is not to generalize across, every single Hmong person, but across the literature, this is what may be more traditional. So many of them consume a higher calorie tradition Asian diet, such as noodle soup, coconut curry soup, and fried egg rolls. They also incorporate more rice into their meals, which leads to additional consumption of carbohydrates, and also adding into this more processed foods as part of the standard American diet, which may lead to more meals consumed throughout the day. And all of this together contributes to developing type 2 diabetes and also worsen control of existing type 2 diabetes. And then relating to religious beliefs and practices, the Hmong commonly practice a belief system known as shamanism. And the religious beliefs of the Hmong can cause misunderstanding and a disconnect with Western medicine. For example, many of the Hmong fear being placed under anesthesia, and many refuse multiple blood tests or procedures, which can lead to non-adherence to treatment plans. So this may require consistent reinforcement and encouragement when it comes to treatment plans and dealing with comorbidities that the Hmong may have. And the reason this project addresses the Hmong is because in this area of Wausau, Wisconsin, there is a higher population of Hmong compared to the rest of the state and actually the whole country. And this was the clinic where I had worked as a nurse and was familiar with this population there. And then through the literature review that I did prior to implementing this project, it was observed that culturally sensitive health education improves physiologic outcomes, including the hemoglobin A1C, as well as knowledge of diabetes self-care behaviors. So in the literature review, I looked at multiple different studies that looked at different chronic health conditions such as diabetes. One also looked at hypertension, and another talked about osteoporosis. And they were also across different minority groups such as the Hmong, as well as Hispanic individuals. And across these studies, as I said, there were positive outcomes relating to physiologic outcomes and then knowledge of self-care behaviors regarding chronic health conditions. And at the end of the literature review, I was able to conclude that there were some gaps in the literature relating to lack of longevity of culturally competent health education and then lack of involvement with registered nurses in the primary care setting. So the aim of this project was to improve hemoglobin A1C levels of Hmong adults with type 2 diabetes. And this led to our PICO question, which was, in Hmong adults ages 18 to 68 diagnosed with type 2 diabetes, does a registered nurse-led culturally sensitive diabetes education program compared to current family practice, department practice, lead to improved hemoglobin A1C levels over a 3-month period? And then the project setting. So this took place in a family practice department at a clinic in Wausau, Wisconsin, which is in Marathon County. And in this department and city, as I mentioned, there's a comparatively high Hmong population, and especially in this particular patient panel, the provider is Hmong and had a high population of Hmong patients. And a primary care provider, the provider mentor, was supportive of a culturally sensitive diabetes education program for Hmong patients, and he assisted in identifying participants for this project. The project sample was comprised of 10 English-speaking participants identifying as Hmong with a mean age of 60.6 years, and participants included 6 females and 4 male participants. All of them were diagnosed with type 2 diabetes with a hemoglobin A1C greater than 6.7% prior to the intervention. The Iowa model served as the evidence-based practice model for this project. The model is an application-oriented guide for the evidence-based practice process and may be used methodically by clinicians to identify issues, research solutions, and implement change. And then I have outlined how the model was applied to the steps of this project. So the first step of the project was participant selection. So I had decided to include individuals identifying as Hmong and then wanted it to be adults, so between the ages of 18 and then the oldest was 68, and they were diagnosed with type 2 diabetes and with a hemoglobin A1C of 6.7% prior to the intervention. So I worked with the provider mentor of this project to identify participants who would benefit from additional diabetic education. And he helped me kind of go through his panel and choose who would be a good candidate for participating in this project. And after participants were selected, which I selected with the help of the provider, 10 participants, I used the electronic medical record chart to find the patient's phone number and called each patient and asked if they would be interested in participating in an education session. And each person who I called actually said yes and agreed to go ahead and talk with me and receive extra education about diabetes and how to manage it. And then we made sure that there was a pre-intervention hemoglobin A1C drawn. And then the evidence-based culturally sensitive diabetes education session took place, which I used PowerPoint in order to do this. And the actual education session was framed around the American Association of Diabetes Educators' 7 self-care behaviors model. This is a framework for achieving behavior change that leads to effective self-management through improved behavior and clinical outcome measures. So as I said, this was the framework for the education, and then through each step of the components of that model, I included culturally sensitive aspects of diabetes management relating to the Hmong. And just to briefly talk about what was culturally sensitive about the education, having to do with healthy coping strategies, family support is especially important for Hmong culture, so making healthy choices that involve family and friends. Eating habits included discussing rice consumption and reducing or replacing this with brown rice if possible, avoiding and reducing processed foods, limiting beverages high in sugar, discussing the high caloric content of some condiments like fish sauce and soy sauce, and trying to avoid eating until very full or stuffed. And then relating to activity and exercise, we discussed the guidelines there of at least 150 minutes per week or 30 minutes per day, and also talked about resources within the community such as the Hmong American Center and free or reduced priced community exercise programs, Hmong sports and fitness groups in the area, and also mentioned some exercises for older adults or less mobile individuals such as chair exercises. And then relating to medication, we talked about how medication adherence helps prevent diabetes complications and that it's important to stick to the recommended regimen. And then I also asked if patients were taking any herbal or natural remedies to try to help lower blood sugar, and also addressed that use of shamans and healers is beneficial to spiritual wellness, and it is also important to take medications as prescribed. Then we discussed if there were any safety or any fear of having needle sticks or blood draws or anything like that. We talked about reducing risk and identifying signs of hypoglycemia. And then the last portion was problem solving, which related to an action plan if the blood glucose is low or high, and adhering to scheduled appointments. Then after the education session, there was a 3-month post-intervention hemoglobin A1C, which some of the participants, they were scheduled at that time, and others I had to reach out and try to schedule them after the education session. And then after the 3-month post-intervention hemoglobin A1C levels were drawn, I compared the pre and post hemoglobin A1C levels. So in the findings here and the conclusion, there was a mean improvement in hemoglobin A1C from 8.03% to 7.7%, which is consistent with the review of literature that culturally sensitive health education improves physiologic outcomes. 3 participants demonstrated improvement while the remaining 3 worsened. The 4 remaining participants unfortunately did not return for post-intervention hemoglobin A1C. And then to conclude, culturally sensitive health education is a cost-effective means of mitigating progression of chronic illness and establishing rapport with an underserved population. And then looking here briefly at the graphic, so this is a comparison of pre and post hemoglobin A1C levels by each participant. So you can see the yellow bar is the pre-hemoglobin A1C, and then the black is the 3-month post hemoglobin A1C, and the ones with just the yellow, so patient 1, 4, 6, and 7, those ones, they did not return for the post hemoglobin A1C, and then you can see which ones improved, and then again the other 3 actually worsened post intervention. Then limitations of the project. So 3 participants, these were patients 1, 3, and 5 labeled above on the graph. They had medication changes during the project, and the data is actually inconclusive in determining if this made a significant impact on the results. And this is because patient 1 did not return for a post-hemoglobin A1C level. Then patient 3 actually worsened even though they had a medication change. And then patient 5 had a slight improvement. So it's hard to tell kind of what the impact of that on the results were. And then there was the small sample size of 10 participants, and then the 4 participants that were lost in follow-up. And this could be partly because towards the end of implementation of this project, the provider mentor actually resigned from his position at the clinic. So then this led some of the patients to go ahead and find a different provider outside of this practice and also be less likely to follow up since he left. So that may have contributed to this as well. And then recommendations. So further work is needed to examine the impacts of culturally sensitive diabetic education for young adults. I would recommend to better define inclusion and exclusion criteria to avoid medication changes during the intervention period. And then a repeat project with a larger sample size with the intervention to occur across more than one setting and over a longer span of time. And then lastly, to ensure follow-up is achieved by making sure all patients at the time of the intervention are scheduled for a follow-up lab appointment at that time. And maybe this would also help less patients being lost in follow-up. And then to conclude, I just wanted to say thank you to my project chair, Dr. Catherine Schmidt. I really appreciate all the time and assistance she has devoted to this project. And then also to the provider mentor for his assistance in this scholarly project as well. Thank you.